All right, so how did we get here in terms of health insurance? Just take a brief history back in time. Prior to 1930, most Americans paid for their health care without insurance, as there was none, and they would pay for basically out of their pockets. Around the time of World War II in the 1940s, employers were looking at ways to entice employees and started offering health insurance that was subsidized by employers around the 60s and 70s, and that's where we first saw unions kind of pushing for more employer sponsored health plans. And then we wound up with what we have today. A couple weeks ago in the Wall Street Journal, there was an article about employer provided health coverage passing $20,000 a year per family of four, which is an insane number when you think about it. And when you look at the actual data, you're seeing that the cost for the employer is going up, but the amount of cost that the percentage that is covered by the employee is also going up at the same time. And with that said, you may think, well, we're getting more value out of this, but in reality, we're seeing deductibles go up as well. This being the average cost about $1,600 for an individual deductible, even sponsored under an employee or a plan. So if you have private insurance, these numbers can be even higher. Because of these rising costs, we find it's important to know how to deliver the most value at the least amount of cost. As doctors, this comic is supposed to be funny, but it's actually real. We're starting to see health insurance and health coverage coming in between the doctor-patient relationship. So as primary care doctors and direct primary care doctors, we have started to navigate the health insurance marketplace for our not only our patients but for employers. Um, one time it was said to me that health insurance is one of the few products that the perceived value is based on the cost that you pay. A lot of people, when they say, well, I have great coverage, I ask them, when was the last time you used it? And they can't really answer that question. So we don't actually know the intrinsic value. So that's what we hope to do and we hope to provide in the direct primary care model is providing that intrinsic value within the model, within visits with us and our practice to the business and to employees.